I didn't think it was important to work for the public service when I actually started working. My dad was a government employee, and I always thought, okay, that sounds okay, but when you start a job, you don't realize what it means. When we started, there was no medical services plan. It all came together from private insurers. As I've grown, it's been the same time as MSP, and actually the ministry has grown.
Working with Marge is a real joy. She is incredibly curious and inquisitive and always helpful, always up for a new challenge. She has an incredible history with the Ministry of Health, and there is no job or issue that she's not willing to jump in and help on.
She is well known for the work she does over the last 12, 15 years now probably in out-of-country care. And the out-of-country care is where we can't provide services here in the province, and we need to arrange and coordinate care predominantly in the US.
Out-of-country provides that safety net for taking our healthcare dollars carefully to buy care for people when they need to leave the province, because we have a great public healthcare system. And if we need to buy something, we have a system to buy that. We're having a celebration because it's sunny and everybody's happy, and we're coming to work, and tomorrow's payday.
Marge is just a really kind of solid person. She is smart, she is willing to listen, she is open to taking ideas. She doesn't always come into a room with it figured out and trying to get you on board. She's willing to hear other points of view and move on. She has spent many years being a union rep and helping to support the unionized staff. She has helped see the ministry through some very difficult times back in the early 2000s.
I have been exceedingly lucky to work with some dedicated women and men who have felt it is their absolute responsibility to take care of, our friends that we work with. Peg and Maria are two of the strongest women I know. The knowledge, the years, the ups and downs have been exceedingly important times. We can reminisce and talk about certain things. It's a very balancing thing to have a dog that you can go for a walk and walk off maybe some of the things that are bubbling through your mind of how to fix certain things. Every day when you go home and have a bad day, the dog doesn't care. The dog just says, I'm grateful you're home.
Marge, in a real way, has touched hundreds and hundreds and hundreds of patients. Would never know who Marge was, many of them. Their families, in terms of the care and concern, to actually support getting access to care.
Yeah, second generation to come in. It's amazing to look back and say, there's been a lot of decisions that have been conscious or unconscious or just lucky to be able to go through as many areas and to feel as if I've grown along with all of the things that we do, all of the connections, all of the places that we reach out to. I don't think I would have ever imagined 50 years later having had such a long, interesting, rewarding ride.